We heard from the Chief Medical Officer earlier taking questions from reporters at the Department of Health. A daily event now during the week since the outbreak. Next week, Tony Holohan will face questions from politicians. He'll be the first witness to come before the new Dáil Committee on COVID-19 next Tuesday. The 19-member committee met for the first time yesterday for over 3 hours, all in private, and chose independent TD Michael McNamara to be their chair. He's with us now. Michael McNamara, good morning.
Good morning, Gavin.
3 hours, what did you talk about?
Well, we talked about how we were going to operate as a committee, how we were going to allocate speaking time, how we were going to ask questions, how we were going to ensure that we received answers to those questions, and how we were going to put a work programme in place for that 3 hours. Seems like a long time, I know, but it was the first time that the committee met together. Obviously, there are divergent views in the committee, and there are different parties represented and independents in the committee. That's what we spent the time discussing yesterday. I think we worked through consensus to a very large extent. Obviously, my selection wasn't, or actually it was. There wasn't technically a vote called on it, but I would like us to work through consensus to the greatest extent possible, and sometimes that takes time.
You'll be speaking to Tony, or you'll be calling Tony Holohan next Tuesday. What do you want to hear from him?
Well, essentially will be Tony Holohan, but also the CEO of the HSE and the Director General of the Department of Health. It's primarily to find out where exactly we're at the moment with regard to the testing capacity in the state and contact tracing capacity, because as the restrictions begin to ease, as we start to open up the economy and open up society, having a testing capacity in place and a contact tracing capacity is essential so that we can do so in a safe manner. And while we've been given lots of targets, and the public have been given lots of targets, they're being told that the testing was being achieved within a certain time period. Anecdotally, there's a lot of evidence that those targets aren't being met. Likewise, we need to find out what's happening with contact tracing. A very large number of civil servants were signed up to help with contact tracing. Some were trained, some weren't. We need to find out what's happening with that, because these are, I think, everybody seems to, almost everybody agrees now that these are essential to opening up safely.
If they are essential, are you confident that the testing and tracing is sufficiently in place to reopen Ireland by Monday to lift those restrictions?
Well, I'm not going to prejudge any answers that we're going to get from the committee. I mean, we're consistently
Which will be the day after restrictions are lifted?
Which will be the day after the restrictions are lifted. I mean, we are confined for the moment to sitting on Tuesdays. The business committee of the Dáil will make ultimately will make a lot of the decisions about what the committee does, but the committee will recommend what it does. So look, I'm not going to prejudge what's happening, but we are being told that that all of the decisions that were made and all of the decisions that are being made based on medical advice. That's obviously something that the committee will be looking into. As a matter of urgency, the committee will also be looking into what's happening in care homes, nursing homes, direct provision centres, etc., and also the opening up of the construction sector, which will be the first sector in the economy to open up, which is also, as you pointed out, next Monday.
What are you hoping to achieve on the committee, and who will you be reporting to? Ultimately to a Dáil that is not able to still pass any laws, for example?
Well, I mean, by the time we're reporting, I would certainly hope that the Dáil will be in a position to pass laws. Of course, the Dáil is in a position to pass laws. It's the Seanad that's arguably not in a position to pass laws. I mean, there are various legal opinions on that, though. I mean, it's not, but I understand, although I haven't seen any sight of it, that the Attorney General has said that legislation can't be passed by the Seanad, but there are contrary legal views on that. But look, that's an aside. We will be reporting to the Dáil. We'll be also in a position to undergo legislative scrutiny. Obviously, at the moment, the secondary legislation is passed. The Dáil and the Seanad empowered the Minister for Health to make regulations. Those regulations were put in place on the Tuesday before Easter and renewed twice since. The current regulations expire on next Monday, so we will be able to look at proposed legislation. I don't know what's proposed next Monday. I don't think anybody has had sight of it as of yet. Obviously, it'll be in place by next Tuesday, but whatever regulation is in place will have to be amended going forward, because there are various steps and phases proposed in the government plan.
Michael McNamara, Chair of the Dáil's COVID-19 Committee, thank you for speaking.